as I said, many patients who came to me, I wrote a WHO paper, and these are the patients that came to us, and we are able to use the same model to help them. Now, we have a very, very busy, clinical practice. Most people think that we are just an adjunct to a pain clinic. Now, what I've tried to do the last, I would say 30 years in terms of our center after its launch, but it's really 50 years for me to figure out how to put the two medicine together, Chinese medicine and conventional biomedicine. How can I put the two together to create a new health model? I think I've done it, okay? Because basically over the years, when UCLA do not know what to do with many of the patients, they were sent to us, and it's a black box. But what happened is that we are able to try to add value to most of the people who get referred to us. So I started as a one-man band. I didn't have much money, but thanks to grateful patients, and also eventually the foundations, like Oppenheimer Foundation, the Annenberg Foundation, and the Panda Foundation, and also many of our patients who have the trust funds or whatever, who has been able to support us. Now, many of the doctors here are working in the clinic because we cannot stop. We have a 4-month wait for our 2 clinics, and one has almost a 2-month wait for a new patient appointment. We have to ration our clinic appointment. We have to outsource our sort of care to our friends in the community. So this is our team, and so the few of the team members will be taking part in this teaching conference. So we have about 30,000 patient visits a year, and it's continued to grow. And that we have been sort of teaching our medical students. Ever since I got started, I started this whole program like December 93. 94, I started the clinic. 95, I already set up the course to teach our first year med students. 96, I have a 4-day conference. And after that, I launched the 4th year course supported by Mr. Gerald Oppenheimer's foundation, $16,000. So we are in the 27th year of our 4th year course. And many of the leaders of our clinic are former 4th year students and rotating residents. So this is sort of a classic definition of what is integrated medicine. I think, Madalena, professor, already talked about person-centered, holistic approach, utilize appropriate therapeutic modalities, and leverage body's ability to heal itself through self-care. Because actually, a lot of behavior, lifestyle, and the way we lead our lives actually contribute to our ill health. So that's sort of what we want to kind of talk about. But so that's integrated medicine. People use different modalities. Our center is the only one that really tried to dive in, understanding Chinese medicine. It's been around for 2,000-3,000 years, has been kept, billion people, I would say, even in the turn of the century, China was like, really relying on Chinese medicine until Western medicine get into China, about 150 to 200 years ago. So we focus on Chinese medicine, and then, but we really think that it's not just acupuncture or herbal medicine or Tai Chi, but really it's the theoretical construct of Chinese medicine that I think is most important. So obviously both share with the biopsychosocial, cultural aspect, but then really we talk about it in medical school now, but then by the time they get into the clinical arena, that has not been focused on until now. We begin to talk about social determinants, okay, while we focus on the molecules, the cells, and the tissue and the organ. So what we have created is a gourmet dish by blending the best, what I think is biomedicine with, Chinese medicine, and create something that I think is safe, effective, affordable, and accessible. I just want more people to benefit from it. And if you use the current model of reductionistic approach to try to find solutions for each one of these conditions, you would never be able to do it. Because I think that when someone comes to you with all these problems, it's not just one problem. They are a person with so many problems. This patient was a young 20-some-year-old graduate student who could not finish her PhD, came to me. She has adverse childhood experiences. So the body has been, the infrastructure has been broken, and we have to slowly try to rebuild it. Once you rebuild the person, many of these labels will be gone. These are Western medical labels of diseases, of organs or tissues or whatever. So she's finished PhD and now working as a clinical psychologist. So we wrote up about our approach, comparing the Western notion of person-centered medicine with the Eastern notion, and then try to put the two together to create something that's workable in a place like UCLA. Now, even the Harvard Medical School Chamber of Medicine wrote this article a few years ago at the New England Journal, putting the patient back together, limits of reductionism, and then recognize the importance of social determinant and understand, which is really the new science. It's network medicine. But you can think about network pharmacology. So this is also sort of now promoted by the NIH, the National Center of Integrative Health and Medicine. And now we have to think about how are we going to try to help the community. And we are so glad to be able to work with Chinatown Service Center because it's not just the medical side, it's really the whole community health that we have to think about. So this is what the director of the NCCIH share in her promotion of the whole health and whole health research. So you have to think about all these factors for us to maintain health for the individual and also for the family and for society. And the VA is also moving into it. Our summer course was attended by 7, 8 of the VA experts about like 10, 12 years ago. So VA is now really moving very strongly into whole health. So clinically, what do we do? I mean, we have like more than 500 physicians within UCLA who refer to us, and obviously some of them just think about, well, go get acupuncture, as if the acupuncture will be solving the problem. No, this is what we actually do. We talk about trigger point injection. We explain the overlap between acupuncture point and trigger point, because that's what I was sort of interested in the 70s when I started getting into this work. That's why during medical school, I already see the potential of putting together acupuncture point overlapping with trigger point, and then come fibromyalgia with a tender point. So by virtue of understanding sort of the points that are active, is the body telling you that you are not healthy. So we also do myofascial release as well. And then we work with our colleagues in OT-PT. We're particularly interested in aquatic PT because I think for a lot of people with hip and back pain. Then we work with our behavioral health, and we work with our subspecialists in different areas like the pain center. Now Dr. Eric Su will talk later on, and then Dr. Helen Reski, a psychiatrist, and also Dr. Mahila Taylor in rheumatology. We recommend our patients to do Tai Chi Qigong. And we teach the patient the self-care. We'll talk a little bit more about what we teach the patient, because without the patient taking care of themselves, and then come to us like every 2 weeks, because we don't really have the time right now to take care of people, on a regular basis or a weekly basis or twice, a week, which is really when someone is very acute, that probably what needs to be done. But right now, we have to ration our clinic visit and teach our patients how to take care of themselves at home. So we take a very good history, because a history is very important. Unless you know about the person, how are you going to be able to, look at what the goals are for the patients, achieve the patients, help them achieve their needs and their goals. And we particularly very, focus on trauma. There's so much trauma going on. I mean, it's not just like what we are facing the last several years, but a lot of, people actually have trauma during childhood. Some of them probably have trauma in utero. Okay, we want to optimize the health of the teenagers before they should conceive, because otherwise you won't be able to give a good genetic endowment to your kid. So that's why our last lecture presentation today is why we need to build integrative family-based adolescent program. So I started with geriatrics because I know geriatrics would need this model. So these are the history taking. A lot of people have car accidents, even minor car accidents. Your neck and the back will no longer be the same. And the trigger points are already formed. And the person's occupation. You need to know what occupation. And so surgery, where is the surgery? Because from a TCM perspective, the area of surgery would tell us a lot about what problem they may be getting. And sports, and what do they do for health? A lot of people have wrong exercise. So that's why we treat the patient. I don't care how many conditions you get, we treat the patient so that you will be able, by virtue of rebuilding the broken infrastructure, then the body will be able to take care of itself. So education is the mainstay of our approach. And because the importance of balance is just like so central, and lack of it lead to depletion. See, what we have is a broken infrastructure, so then the body cannot handle the usual stress we take for granted. So you get different labels depending on what specialty will see you. So these are some of the things that we will talk about later on, what we do in the clinic. But self-care is most important. And by virtue of understanding the patient, you kind of see how long it would take the person to rebuild the infrastructure. Because if you don't rebuild the infrastructure, all you do is just keep patching it up, which is, I think, we are very good at in conventional biomedicine. So let me see how much time do I have, because I need to kind of at least have someone understanding what Chinese medicine is really all about. Because I think that without understanding what Chinese medicine, because most people say, oh, there's nothing in Chinese medicine, we need to study it from a Western approach to study Chinese medicine. No, I think that there's a lot that the West can learn from the East. This is what I've done the last 50 years as in my whole journey at UCLA. Not enough people put their energy in learning about what Chinese medicine. So Chinese medicine never break down the body, mind, and spirit. And it kind of see that at the functional energetic level, it relates to nature and social. And I think the model that we have created would also be helpful for climate change. Well, we don't have time to kind of talk about, but this is what I was talking about, in another international conference. So these are the pathogenetic type of factors in Chinese medicine. Most people say, well, Chinese medicine don't believe Chinese don't believe in psychiatry. No, because the Chinese medicine never separate the body, mind, and spirit, so that the Chinese recognize the emotions are so important in someone's health. And then the Chinese obviously look at climateric change, even the minor change. I'm not talking about hypothermia, hyperthermia, but even for someone who is deficient, who's depleted, a little change in temperature, or just turn on, the air conditioner, okay, make a big difference for someone who are not, having the pattern that we will talk about, the constitution. So reconstitution, overexertion. In Chinese medicine, excessive sexual activity. Okay, well, that's another talk. Poor dietary practices, trauma of different type. But right now, iatrogenesis meaning that it's like a medical profession induced. Okay, do you know that the New England Journal just published a paper that 1 out of 4 patients in the hospital have problem, caused by medical, intervention. 1 out of 4 in hospitals in the United States. So both medicine would collect data. Obviously, nowadays in China, they even overuse the technology of Western medicine and not use the classical approach of Chinese medicine. So I just want to talk about the Chinese concept of pattern, because by understanding the Chinese pattern, you will be able to treat many different seemingly diseases that are linked into this pattern. And I'll go over only a few patterns because there is already a corresponding treatment in Chinese medicine. And that's why this is so important for geriatrics and for primary care and pediatrics too, for that matter, to understand the pattern diagnosis. So these are some of the sort of classic diagnostic ideas, approaches of Chinese medicine, but then it come up with the pattern diagnosis. And in general, it's really related to an imbalance. They call it yin and yang, but I think in Western medicine, we can talk about autonomic, neuroendocrine, immunological, and vascular, oncologic type of imbalance. And then flow, you have too much or too little. And then the Chinese are able to look at it at a micro level before you have a stroke or MI or so on. So I think that, unfortunately, even in China, a lot of people really do not understand Chinese medicine because they've been fascinated with what's in the West. So qi stagnation is very common because this is really like more or less like the stress that we all encounter. So a lot of people have pain and discomfort, particularly in the neck, in the rib cage, and also in the pelvic area. So that's why you can treat this pattern so that you don't have to go to see a neurologist for the migraine and the GYN for the pelvic pain. Obviously, you need those experts to try to rule out some of the very dangerous red flags, as we call it. But most people would just have this sort of pattern, and there's a corresponding treatment. So blood stasis is a much more advanced. The Chinese actually recognize problem at the very physiological, early abnormal physiology level, but then you don't take care of it, it goes deeper and deeper, and one of the area would be blood stasis, vasculitis, vascular, disease, and that, and so see that when I put down capital L or for liver or so on, these is not the Western anatomic liver or GI or the spleen system. It really is the functional system. So in a sense, it's not easy for people to learn, without really confused, because the dominant system thinking for most people, even in China, is the Western, class biomedical, language. So it took some time for people to really understand, what Chinese medicine is all about. So I'm trying to, transliterate some of these, ancient language into modern way for people to get it right away, so that they see the two medicines actually have a lot of overlap and where the difference is. And that the difference is really talk about the concept of qi. Qi is not flowing, or there's not enough qi. When you don't have enough qi, you know that at the end of the day, you're tired. Okay, you check your blood, they're all normal, right? You don't have much change, but you have lower qi. So what happened is that you will feel tired. And so if you have a chronic disease, for sure you have qi deficiency. If you are older, you'll have qi deficiency. So this is another way for the Chinese to kind of get the body to tonify, the qi, which is really building the infrastructure that I talked about earlier. So the Chinese look at the tongue, which is the pink tongue is the healthy one. You can see that with qi stagnation and then all the way to blood stagnation. Let's give you an idea how you can actually look at your tongue every morning to see how healthy you are. So pain or any condition is due to impaired balance, impaired flow, and decreased homeostatic reserve. I think that most people in Western medicine will agree with me that this is really, the same, except that with the imbalance, we block, we stimulate. When there's something that's missing, we replace, okay? So impaired flow, I mean, that's why what we do with, stents, and we do bypass, but flow could be constipation versus diarrhea, or watery eyes and dry eye. So I think that it's not just pain. What I'm trying to say is that I tell my patients that pain brings you to see us. Without pain, that's why even chronic pain is important, because if people do not have chronic pain, they don't have a pain signal, they will have other symptoms. The most important thing is to deal with the muscle spasm. Tightness in your neck, tightness in your shoulder, tightness in your back, okay? If you have tightness and you don't take care of it, it would lead to other conditions. It can give you cough, it can give you dizziness, it can give you skin problems. So by virtue of re-regulating the system, reestablish the flow, rebuild the system to maintain the flow and the balance. So this is a very simplistic way of kind of talking about how this leads to pain, but you can put down almost any label, okay? So I just want to kind of say that the Chinese, when they talk about wind, cold, and damp, many of the Chinese in the audience would know that wind, cold, and damp, and you get a lot of pain, okay? And they call it the B syndrome. And I had that when I actually was having a picture taken with the sunshine, warming me, and then the black cow came over, and then I feel a chill. I couldn't move my shoulder. So that's even the Bell's palsy. A lot of it is really like a wind cold attack on the seventh nerve due to the spasm of the muscle. So I don't have time to really go through many of these sort of details about Chinese medicine. So let's really talk about how do we restore balance? How do we restore flow? We talk about the idea about individualization. And then the most important is to how do you rebuild the body's homeostatic reserve, or qi. So by virtue of us who are dual trained, we train in Western medicine. Most of our doctors are board-certified internists and board-certified family medicine. But then at the same time, we have different level of understanding of Chinese medicine. We know how to put the two together. We have an additional way of organizing the information that seems to be very difficult. And in general, Chinese medicine look at the forest. Western medicine look at the trees, the branches, the roots, okay? And become so subspecialized right now. I only do shoulder, I only do ankle, I only do retina. But we can actually help the patient with eye problem or other problems by taking care of the person. So these are the key components of our framework. And really don't have time to go over, but the key idea is that the person, if you give them the chance to heal, it would heal. And that we call it the placebo response, okay, in Western medicine. And that the most important thing is to understanding the person, the root. The root is really a lot of issues, stress at home, or the wrong exercise, the wrong diet, and the way of how they handle their emotions. So I think many people without pain, they would have other non-pain manifestations or diseases. Now, people with sudden death, they don't have the pain signal for angina for people to really recognize that there's a problem. So pain is actually not necessarily bad. Chronic pain is because we cannot turn the pain signal off now. We don't need it. Just information is important. You need information, but it does not, get turned off. So that's why you just need to train the body, do things to prevent the body, so depleted that it cannot turn off the normal physiology that become too prolonged beyond its regular use.